Welcome, everyone. It's Dr. Hoff here with Tabix Pacific Chiropractic of Brooklyn, New York. For this week's Health Talk, I'll be covering chiropractic care and migraines. A migraine headache is a neurological condition that can be debilitating. Migraines are very common in the United States. Nearly 1 in 4 suffers from a migraine. A migraine can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. It's often accompanied by nausea, vomiting, and extreme sensitivity to light and sound. Migraine attacks can last for hours or up to days, and the pain can be so severe that it interferes with your daily activities. Migraines can begin in childhood, but often occur in adolescence or early adulthood. Migraines can progress through 4 stages: prodrome, aura, attack, and postdrome. But not everyone experiences all of these stages when they are having a migraine. Stage 1 is predrome. Predrome can occur 1 to 2 days before the migraine. You might notice subtle changes that warn you that there is an upcoming migraine. These changes include constipation, mood changes, neck stiffness, increased yawning, and increased thirst and urination. Stage 2 of a migraine is the aura. Aura or stage 2 can occur during or before a migraine. Auras are reversible symptoms of the nervous system. They are usually visual, such as seeing bright spots or flashes of light and vision loss. This stage can include other disturbances like pins and needles sensation in an arm and leg, weakness or numbness in the face or one side of the body, difficulty speaking, hearing noises or sound, and uncontrollable jerky or other movements. Stage 3 is the attack stage. Migraines can usually last from a couple hours up to 3 days or more. Migraines might occur rarely or strike several times a month. During a migraine attack, you might experience pain that's usually on one side of the head, but it can occur on both sides of the head. Pain that throbs and pulses, sensitivity to light and sound, and sometimes even smell and touch. And if you can also experience nausea and vomiting. Stage 4 is your postdrome stage. This stage happens after a migraine. You might feel drained, confused, and washed out for up to a day. Sudden head movement might bring on pain again briefly. But migraines can be triggered by hormonal changes in women, drinks like wine and caffeine, stress, sensory stimuli to bright lights or sun, intense physical exertion, missing sleep, certain medications, and diet like processed cheese, processed foods, and skipping meals. One of the major complications with migraines is taking combination painkillers. Taking painkillers such as Excedrin for more than 10 days a month for 3 months or in higher doses can trigger serious medication overuse headaches. The same is true if you take aspirin or ibuprofen for more than 15 days a month. Medication overuse headaches occur when the medication stops relieving the pain and begins to cause the headaches. You then use more pain medication, which continues the cycle of headaches. But migraines often go undiagnosed and untreated. For many years, it has been said that migraines are caused by genetic or environmental factors. So what is the true cause of a migraine? Well, according to the Mayo Clinic, changes in the brainstem and its interactions with the trigeminal nerve, a major pain pathway in one of our cranial nerves, is the major cause of migraines. Also, imbalances in the brain, chemical imbalances, including serotonin, which helps regulate the pain in our nervous system. At Tabix Specific Chiropractic, we work directly with the brainstem and the spinal cord. Here is a model of your skull and the first 3 bones in your upper neck. This is a side profile of the model. When one of these top 2 bones in the upper neck shift out of their proper alignment, they put pressure on the brainstem, causing a blockage between the brain and the body. In chiropractic, we refer to this blockage at the brainstem as a subluxation. Our job is to analyze, locate, and correct that vertebral subluxation. As specific chiropractors, we have an instrument that detects the pressure on the brainstem. This instrument allows us to determine when to adjust and when not to adjust through analyzing the spine via spinal scans with an instrument in an attempt to find any potential blockage at the brainstem. Here at Topic Specific Chiropractic, consultations are always complimentary. We never charge you to sit down and discuss your concerns to determine if you are a healthcare candidate for our office and how we can best serve you. When there seems to be no hope, we are here to give you hope. Call us today at 718-745-8177 to schedule your complimentary consultation. If you're new to our office and you want to see what we're all about, mention my name, Dr. Hoff, and this health talk and receive up to $100 off your initial x-rays. Thanks again for being here, and join me this time next week for a health talk covering the effectiveness of chiropractic care for high blood pressure and diabetes. Thanks again, take care, and have a wonderful week.